BCG vaccination in Antrim Hospital. We run a weekly BCG clinic in the Acorn Centre on a Wednesday morning, starting at 9:15 a.m. and finishing at 11:30. Patients referred to this clinic are direct referrals from C2 postnatal ward, and this is based on their pre-discharge risk assessment checks, whereby if the parent or grandparents are from a country of high risk of tuberculosis, the patient will be referred on for BCG vaccination following delivery. When they attend per clinic on the day, we provide a risk assessment form initially for the parents to complete. This is to ensure that the child is well on the day and there are no variables that would contraindicate immunisation. The parents will run through the questionnaire, checking the boxes that are applicable, and if there are no adverse reasons for administration, then we will proceed with vaccination. The consent forms that we have are unscheduled vaccination forms. These are forwarded to Child Health, who are not part of EPIC as yet. This is to roll out in due course. For the meantime, we will discuss the rationale for vaccination, the mode of administration, the risks, the benefits, and the side effects of the BCG vaccination. The form will be signed by the parents in this section, and we will complete the details of the vaccination down below. BCG is here, AJV is the licensed product available in the UK, and we will fill in the expiry date and the batch number for the vaccine on the day prior to signing off. After clinic, the ward clerk will kindly upload these documents to the media section for the patient record. So part of our responsibility is to make sure that the charting is complete for coding. So my reason for attendance today will be a vaccination for the child. Under visit diagnosis, if I type in bacillus, I will be able to choose the option for Bacillus calmette-guerin vaccination given. I will then order my BCG prior to administration in the bottom left corner by typing BCG. The little injection icon means it's an in-hospital administration of the BCG vaccine, so I will check that. My dose will be 0.05 mils, and this is as per the guidance in the Green Book, Chapter 32 for tuberculosis, the National Programme of Vaccinations. Prior to signing off my order for the BCG, I will address the allergy status with the parents, and if all is good to go, we will mark this as reviewed prior to signing off our order under the named consultant that the baby was born under, and this is based on the month of birth. The named consultant will be Sanjeev Bali or Dr. Conor O'Neill, depending on which month they were born. The prescription for the BCG, then, you can see is identifiable on the MAR when I go into that section, whereby if I click on this square, the box will come up to complete the administration check process, and this is a dual sign-off process, but this does not interfere with administration because there is a nurse practitioner and an SHO assigned to clinic each week, so 2 persons are always present, thus facilitating our dual sign-off in a prompt, timely manner. Once my vaccine has been administered, then I will go into my conclusion section, which is formulating my note and the letter to the GP. On the right-hand side, this will be my note that forms the body of my letter. So this is our BCG clinic on the day. This note I tend to co-sign with the baby's named consultant, and that way they are aware that the baby has attended on the day and had the vaccination given, or they did not attend. Using my smart text, which I had already developed prior to EPIC rolling out, I have a pro forma for the clinic note. This describes the process of discussion, administration. I can complete the batch number and the expiry date for the record purposes prior to signing it off. And that will be my note. I check the indication with parents. I will document that the parents are from Romania. Prior to completing my note. Once I'm happy with the content of my note, then I can just finish off the documentation process. You have to choose a visit outcome. That will be first treatment today, discharge. I will then make a letter to the GP, selecting the GP's practice name here. I will choose the template as going to be my clinic letter. I will amend my letter, taking out bits that are not necessary to make it more legible for the GP. I can right-click any blue areas to make the selected text editable. I can take out bits that I don't need the GP to see or to have. I can simplify my letter and just have necessary detail in it for their records, taking out that which is unnecessary. Once I am happy with the content of my letter, I will then send it on to the GP on the day. And that is the completion of the clinic. Everything has been done that needs done, so I can sign my encounter and BCG administration has been completed successfully.